I'm In with the ARCC is brought to you by StoredTech, your technology, our passion. And now, here's your host for I'm In with the ARCC, Amanda Blanton.
All good. Welcome to I'm In with the ARCC. Thanks for joining us today. I am your host on marketing and communications for the Adirondack Regional Chamber of Commerce. And today I am here with Kevin Collins. He's a doctor of chiropractic at O'Leary Chiropractic. Kevin, welcome to the show.
Thanks for having me.
Yeah,
it's awesome to be here.
Happy to have you. We actually met for the first time at the Young Professionals Speed Networking event a little while back.
Yeah, a couple weeks ago.
That was cool.
It was fun. Yeah, it was a good turnout too.
Yeah, I'm glad you were able to come too and, represent the other chiropractics here in the community. So it's wonderful to have you on the show as well. So I want you to kind of take us back here. I'm always curious because I've had chiropractors on this show before, and I'm always curious, like, why did you decide to pursue this as a career and kind of what that journey looked like?
Yeah, so for me, I'm personally a second-generation chiropractor.
You are? Okay.
Yep, my dad is a chiropractor as well, and he's here in the area. He was the one who pretty much inspired me to become a chiropractor.
Cool.
I mean, I grew up playing a lot of sports, mostly contact sports, so football, lacrosse. I've got two younger brothers, so we're always beating each other up. And I saw all the benefits that chiropractic really gave for me.
Yeah.
I got adjusted my whole life, mostly as I needed it, but I even go in routinely, periodically for maintenance, and I just see the benefit in it. I've seen how it's helped other people.
Sure.
It's a very holistic,
like approach
treatment
to health.
Yes,
yeah,
exactly.
Absolutely.
So I like helping people. I like using my hands, using my body. So it's really the best of both worlds there. And
That's
then
really cool.
Yeah, and to be able to get people back on their feet and doing the things that they like to do is probably one of the better parts of it too.
Absolutely.
Yep.
Yeah.
So he was the one that got me into it, and it's funny because he told me, "Oh no, don't be a chiropractor." So I think he wanted me to go into a different field, but I think it was right for me, and I made the right decision.
Yeah, yeah. Well, I mean, and you saw him doing the work growing up, like you mentioned, and being in a lot of contact sports. You were used to that. It was a part of your life.
Yeah,
so,
and I didn't realize how few people actually do go to the chiropractor.
Sure.
Until I started talking to people, growing up and realizing, not everybody actually goes, but I felt great all the time. So I figured there's got to be something that's working here.
Yeah.
Getting me back on the field and keeping me, upright and moving.
Absolutely. You had the benefit of growing up around it, so it was comfortable for you and normal and all that. So
exactly.
That is really cool. I love hearing how people get into what they get into, right? Because personally, I went into marketing because I thought it was a safe bet, right? Sure, I had some interest in it, but could have been other things, right? But you had a family inspiration as well as your own personal experience. So
well,
really
now
cool.
that you touch on that too, I don't think AI can touch chiropractic, at least not
That's
yet.
true.
So
Kevin, your job is safe.
Yes, I hope so. It's another good pro.
I know. I love that. And you never know who's listening, right? Someone, might have a young person in their life that is seeking out a career path, and you never know. They could get inspired by what you're saying today. So
that would be awesome.
Always like to put it out there, right? Yes. So you talked a lot about sports, like contact sports. We can understand there's injuries that are involved with that. Chiropractic care as well as other care go hand in hand with that. But there's so many reasons why you would seek out chiropractic care. I'd love to talk about that.
Yeah, sure. So kind of to touch on the obvious ones. So traumas, contact sports is in that category, car crashes, things like that, slips and falls.
Accidents.
Those are all, they pop right into your brain and you say, I need to get this worked on. There's definitely other, more obscure or, smaller, maybe conditions or ailments that we can treat as well. Which is something I don't think a lot of people realize. Also the repetitiveness. So a lot of, repetitive motions that you're doing every day at work, whether it be a lot of sitting, it's going to be a lot on the joints. So we do talk about a lot of, things to help when you're at work, things at home that you can do to help, because there's plenty of time throughout the day where you're stressing your body in different ways, and it does need to be worked on. So those are things that if people allow to kind of sit around and they don't proactively do anything for it, can, worsen and become more of a pain. And that might be something that brings them into the office. But it's really some of those things that aren't more obvious when you're first kind of thinking about it.
Absolutely.
That are some things that we treat. So things like that, you asked for some examples, would be vertigo would be one. So, dizziness in the head. There's, multiple different causes for that, but there are certain causes that are treatable. a couple other ones just off the top of the head. Mostly are really posturally related.
Yeah.
A lot of people sit for work, which is common nowadays.
I'm one of those people, yes.
And the more and more technology we get, the less we're moving around and moving our own bodies. So a lot of these things that kind of pop up, maybe over a period of time and slowly worsen are things that also maybe not come to the front of your minds, but are definitely treatable.
Well, I'm glad you brought up the kind of sedentary lifestyle, right? Because I think some of us assume if we're not moving around too much, how could we possibly injure ourselves, right?
That's very common.
You always think of an injury as something that is the result of an action.
Yep.
But the action or non-action of sitting too much, or even worse, sitting in a terrible posture, can actually probably do just as bad of damage as an injury.
Yeah, you don't even have to compare them because they are different.
Yeah.
So if you are, one of those people that is putting yourself in that, former category where it is more postural or ergonomic, it is something that, doesn't pop right up in your brain.
Sure.
But when we come in, it's part of our testing that we do. We look for things like that.
Yeah.
And try and get people to make those little changes that make a big difference, over time.
Absolutely.
Yeah.
And I think you don't realize that you're hurting yourself in the moment, right?
Yeah, it's not intuitive for the most part. So
I think about all the time I spend sitting at a desk and my silly watch is like screaming at me all day.
Yeah, tell you to move.
Move around. And, 90% of the time I listen and I'll do it. But sometimes you get in the zone, right? And you're working hard and you're slouching and your wrists aren't positioned correctly and you're typing and you're doing this and that.
Yep.
And you're like, what's the harm that could happen? Well, after months and years of that repetitive
day
behavior,
over day.
Yeah.
Exactly. And even here I see a couple different computer screens, but that's a question I'll ask people too if they work at a desk. How many screens are you looking at?
Oh,
which one are you looking at more?
Yeah, and you're looking at me because I have screens. Like I
usually guess which way you're turning your head more frequently because things will tend to tighten up on that side. Those joints aren't going to be moving as well.
Right.
So there's a whole kind of myriad of issues that can arise, and that's something that we do look at as well.
Absolutely,
so it goes into the process there.
Sure, and I even think about our youngsters, right? And it always amazes me how young people have phones. Not sure what they need them for, especially if they're under the age of 16, but they have them, right?
Yeah.
And the posture I'm talking about. They're either walking or sitting or standing and, faces down, looking at their palm, and they're just they're doing whatever, right? That's got to do some damage even on young bones, right?
Well, if we're talking about the head, it averages about 10 to 12 pounds. And when we're talking the head on top of our spine, so starting with the neck, when you transfer that weight forward, so looking down at your phone screen for a long period of time, that shifts that weight. Quick little anatomy here, a little lesson, but we're shifting that weight forward more onto the discs of the spine, which when you hear about a lot of spinal injuries, many of them are disc related. Especially when you're young, you want to keep those discs as healthy as we can. As you get older, they naturally are going to degenerate. They're not greatly hydrated and they don't get a great blood supply, so they don't heal very quickly. That's why we want to keep them as good as we can, as long as we can.
Sure.
Because as we get older, those are going to start to deteriorate naturally just with gravity and, like we were talking about before, the things you do in your day-to-day life, work, everything kind of adds in with that. So those little positions and keeping yourself in a proper position, even if you're looking at your phone, ideally, up at eye level, it's going to save you a lot of strain on the neck.
Sure.
Yeah.
Absolutely. I know. And it's funny, every chiropractor I have on this show, I do think of these things more often, especially when I'm out and about and I'm watching other people's behavior and I'm like, oh my gosh. And I'm guilty of it too, right? I'm a phone scroller.
It's not like I never do it either.
Whether it's horizontal or vertical, we're all doing it. So
yeah, it's about catching yourself though and trying to be mindful of it. That's something I talk to patients about because it's something that isn't really brought up often in healthcare, is quite literally just thinking about what you're doing as you're doing things.
Absolutely.
You oftentimes, like you mentioned, get in the zone or you're working and you just lose track of where you're at posturally or, in the day. So you want to just get back on track, remind yourself to keep doing these things that are going to help yourself long term.
Absolutely. Yeah, we don't often live in the moment. So.
Yes. Try and get people back onto that.
So let's talk about maybe some warning signs that would prompt someone to consider chiropractic care or maybe we don't think we should call a chiropractor, but you're like, wait a minute, that's a sign you probably should.
Yeah, so I think that's a good question. Simply put, pain or discomfort, any signals that your body's telling you is pretty much that exactly. It's a signal to your brain to let you know that something's not going on properly or as it should.
Yeah.
So whether that be an injury or an overuse or a strain, or you could even have, some spasms in muscles that might be weak and overworked. These are all things that, could bring you into a chiropractor.
Sure.
Also, there's pains that, we might not be the best ones to help with, which are things that we're trained to look for. More red flag is what we call them.
Sure.
Signs or symptoms. Those are our more intense things that kind of signal, cord compression or possible strokes, more life-threatening or life-altering conditions that oftentimes people will present to the chiropractor with because they're similar symptoms: neck pain, back pain, headaches oftentimes.
Yeah.
But we have to be able to tell, okay, this isn't something that, we can help with currently.
Sure.
You need to go here first and get this treatment prior, and then maybe come back after if your back's still bothering you. But there are those more red flag or severe conditions that we have to be knowledgeable of and really do your due diligence on, so that the patient gets what they need and that they get sent to the right spot.
But that's interesting because, maybe you are the first call, right? Someone's got some clicking in their neck or their back hurts, and they're like, I'm going to call a chiropractor, and you could discover something that's maybe a little out of your realm of expertise, but you can get them on the path healing.
Yep, and that's what we're trained to do.
Yeah.
So we're portal of entry providers, which is, you don't need a referral to come and see us.
Okay.
So you could walk in with any really condition, and we don't catch it until we get into the room with you, start talking with you, start doing our examination on you, and then uncovering really what's going on. So it definitely has to be in the forefront of the mind, not even with just new patients, but people that do come in and have new things going on.
Yep.
You have to go back, kind of look through what happened previously. How are these symptoms different? What possibly could be going on? Is it a new condition entirely? Things like that. So I think back to just last week, I had a patient in, and she was having some pain, different than what we were working on previous.
Okay.
I asked a couple other questions. She was having some blood in her urine, so we sent her out to the urgent care, and she ended up having some kidney stones, which, luckily it wasn't anything in the urinary tract or lower down, but now she's being managed there with some medications. So I really try and co-manage a lot of my patients with medical professionals. So
that's
MDs,
really
DOs, PTs, really the whole myriad of the healthcare community. I think that's what's best for the patients is getting them not only to just one spot. Sometimes you need to go to a couple different providers to get what you need. So try and keep everything organized, make sure we know where they're at in their care. If there's something that's flaring up or we're kind of concerned about, then we can address that as it needs to be addressed.
That's great to hear because nobody wants to spend all their time jumping from provider to doctor to healthcare professional without any guidance.
Yeah, and with all the waiting times now, it's it's not only a waiting game, but you're suffering through that whole time. And if you end up waiting 2 weeks and going to the wrong place, then you're back at square one. So we're trying to cut down on sending people to 100 different doctors and try and get them to where they need to be quickly.
Well, that's appreciated, truly, because I think we either have experienced that personally ourselves or know someone that has. So thank you for doing the good work, Dr. Collins.
We do our best.
I really appreciate you taking kind of a deep dive on the anatomy pieces because I think that might help some people feel more comfortable about it as well, right?
Yeah, and I love the anatomy. That's a major part of a lot of what's going on with a lot of these conditions that people present with. So it's really relevant, and I try and educate people as much as I can on what's going on so they at least have an idea of why things are hurting and why certain activities or motions might bother them more, so they can be more mindful of it. Kind of touch back on that again.
Well,
and
that's
then,
it. And, maybe make lifestyle changes, right?
Exactly.
Yeah. Very cool. Awesome. So I want to talk a little bit about some misconceptions about chiropractic care. You've probably heard them all.
Well, there's definitely quite a few.
Yeah, they just crack your bones or, whatever. And I know that it is an adjustment. That's how you all refer to it. But what are some other maybe interesting misconceptions you've heard, and how would you like to clear those up?
Yeah, so there's definitely a few. You brought up the cracking one, which is a good one.
I know. I'm going to laugh, but it's
it is.
You're not literally cracking people's bones. Like, that's crazy.
Yeah, and unfortunately, when we kind of look at the history of chiropractic, there is there's changes that have occurred over the years.
Yeah.
It used to be much more philosophical in the past, where there is still rooted in deep philosophy and why we're doing what we're doing.
Okay.
But the reasons previous were more so, we're moving this bone and we're putting this bone back into place because your bone was out of place. We try and get away from that now because that's literally not what's happening.
Right.
Okay. It's more, we're building up pressure in the joints, which are enclosed capsules. So they're pressurized systems. And as you move around and build up, stress in that joint, there's little dissolved gases in the joint. It's oxygen, nitrogen, carbon dioxide that actually change through those pressure differentials, as you're moving around throughout the day. That's kind of what builds up that stiffness. So when you're cracking your knuckles, you're actually just popping those gases, and those gases are dissolving back into the synovial fluid inside the joint.
Oh.
So we're not removing bones. We're actually manipulating the joints, which are the spaces in between the bones, which oftentimes is where a lot of stress builds up. And then we're also addressing the soft tissue, so the muscles, the tendons, and the ligaments, depending whether it's a sprain, strain, or a spasm.
Sure.
It really depends on the condition. Things change from patient to patient, but that's really the main idea behind what we're doing there.
Sure.
Some other misconceptions too. The big one that I hear that I try and talk about a lot, just to educate people again, is chiropractors cause strokes. That's a big one. And stroke is kind of misleading here because the term that people refer to when they're talking about this is vertebral artery dissection, which is a fancy term for the artery that's running up through your neck and actually connects in with the brain, is getting cut, so the wall of the artery gets sliced a little bit, blood can't pool up, or starts pooling up because it can't flow as well because there's an interruption in the blood vessel. And that's actually what's causing that stroke there. Now, when we talk about the vertebral artery, I'll kind of jump into this a little. It takes a very windy path through the neck. If we take the spine and you look at just the skeleton, there's little holes on the side of the bones in your neck where this artery is quite literally running straight through. And that's what those holes are for. It's just for that artery to run up. So it's kind of protected there by the side of the neck, and then when it gets up underneath the skull, it winds back behind the back of the ear and then up into the skull. That's where those couple segments where it gets really windy up at the top of the neck, and we get a lot of rotation in that area, is where these problems tend to occur. And it's been shown in studies that it's likely, well, it's not likely, it is being caused doing day-to-day activities. So extension and rotation of the head put the most strain on that artery. And there's, some people have conditions that can weaken some of the arterial wall matrix and make it a little weaker there. That puts them more susceptible to these conditions. With those patients, we wouldn't be doing, upper cervical adjustments with them. We would change the technique that we're doing. But these are all things that we kind of have to look for. Like I mentioned previous, kind of touch back on that. When someone comes in, we're asking these questions. We're checking, doing exams to specifically look for occluded blood flow up to the brain, and kind of ruling out any of that possibility. A good study that I was actually looking at before I came in was a population-based study by Cassidy, Whedon, and Kosloff, which examined hundreds of millions of patient interactions over the last several decades. And these investigations consistently revealed no causal relationship between chiropractic manipulation and vertebrobasilar artery stroke. Furthermore, patients who actually experience these dissections, when they go back and look at them, they're equally likely to have come from a chiropractor or an MD, which shows that it's not just the adjustment, that these are likely here before. The most common complaint with these arterial dissections is neck pain and headaches, which are two of the top 4 reasons people come to see chiropractors. Then stresses again the need for a really in-depth examination, ruling out any of these possibilities, because this is something that can be life-altering for people, especially when we're messing with blood flow up to the brain. So those are pretty important things there.
Wow. I love that deep dive. Holy moly.
Sorry, a little too deep dive. It's hard without like an image to look at too. But if you end up looking up even just the skeleton, you'll see those little holes in the side, and then you can look up the vertebral artery and see how windy that path really is. Like right before it gets up to the brain too. So
all the amazing things that are going on in our bodies, right?
Yes, very complex, and it's all packed in a very small space too.
I know it. So I would really, because we don't have a lot of time left. I knew this was going to happen.
I like to talk. So.
No, but I'm really intrigued by all of this. I think we understand some of the benefits of chiropractic care, because it does kind of go hand in hand, as you had mentioned, with your other health care, right? But I want to help people understand what a first visit at O'Leary Chiropractic would look like.
Yeah,
Let's
so
ease people's minds.
So say you're already on the schedule, you show up, our lovely front desk associates will help you out with the paperwork, make sure everything's filled out. They'll take any insurance information that you need.
Okay.
Then they'll bring you back into the room. Then the doctor will come in. We'll have looked over all your paperwork. We actually have access to a lot of the medical imaging records around the area. So I usually look up patients before I go back with them, see if they've had any previous x-rays, MRIs, CTs, anything like that. That might be valuable just to have an idea of what's going on. Then I'll go back in, and it really starts with what we call a history. So it's a very in-depth, this is really the most important part, is talking to you, figuring out what's going on. So we want to know where, why, when, what happened, if anything, if there was a trauma. We want to know what you've been doing that helps, what actions or motions you've been doing that bothers you, if it's been getting better or worse, if you're having any numbness, tingling, or weakness, some more neurologic symptoms. And then we also want to know kind of time of the day, how your sleeping's been affected, things like that as well. We'll also go into any previous surgeries you might have had, any other conditions that you might be dealing with, as well as really double checking, making sure that there's no contradictions for anything that we're going to do. After we get through all the long talking that we do back and forth there, we do what's called a physical examination. So we do a lot of orthopedic testing, which is really moving the body around. We're trying to stimulate the pain response. So we're trying to really stress tissues, specifically, whether it be muscle, ligament, joints, or nerve, and then elicit that pain response to figure out exactly what's causing the pain. So it might be a lot of pressing on you, pulling, having you move left and right, things like that. But that's going to be really informative for us. And kind of pinpointing the pain. Then after I move you around a bit, we check the neurological function in the legs or the arms, whatever it may be. So we'll do reflex testing, we do motor testing, make sure that the muscles are still working, communicating with the brain properly. And then we'll kind of go through and do a palpation. So that's really putting hands on the person, feeling what muscles are tight, feeling what joints are restricted, where maybe some really intense spots of pains are, or where it might be more loose on one side. So getting kind of that full picture is really important on the first visit. After we do all that, I sit people up and I'll explain what I think's going on with them, and then I tell them how long I believe it's going to last, how long I'm expecting this process to take, and then what I want them doing not only in the office but at home. Like I mentioned, those times when you're not in the office to be mindful of, and then kind of add in whether it be stretching, exercising, preventing certain motions, things like that. So it's really a lot all packed in about 45 minutes. But then we do the treatment after that. Kind of explain those stretches and exercises that we want you doing at home, and then we send you off on your way to go do those things at home, and then come back in usually a few days, maybe a week later, see how you do, and then continue treatment there. One big thing I do tell people is it's rarely a one-time fix. So when we're talking about the body, and there's so many factors that go into it, but depending how long things have been going on, the condition of your spine, age, activity level, what you do for work, these are just some of the factors that we talk about and that are going to influence how quickly I'm expecting you're going to respond to treatment. So it's rarely a one-time fix. I've had a few patients where it's nothing major and they do need to come in just once or twice and they're good to go. Oftentimes it's 2, 3, 4 weeks, sometimes a little longer depending on the condition. But we can get people back out to doing the things they like to do, hopefully in a timely manner there. So that's really everything that goes on in the first visit. When you come in the next time, we don't do any of the long history and the orthopedic testing, because we've already know what's going on there. But we check in, see how you've done compared to the last time, make sure things are improving, and then we go right back into the treatment and keep everything moving.
Hey, listen, I like a lengthy, detailed.
It's the most important. It's the most important thing.
And a lot of people want to be heard, and they want their. They just want to put it all out there, and you're ready to receive. And it's very important information, too.
It is. And like you said, people want to be heard. And unfortunately, there are, some doctors in all fields that are busy and make you feel like you're not heard. So the goal is to do the opposite there, is to make you feel heard. That's great. And get you feeling better. That's really the end goal.
That's awesome. And you mentioned past imaging. Do you also offer imaging on site? Should a person not have a history of imaging?
So we, it doesn't matter if you do or don't. You can still come in. We don't have imaging on site with our facility, but I'm fully qualified to order any imaging that I think we need, whether it be X-ray, MRI, CT. So we do that full exam. If I think we need some imaging before I want to start working on you or moving the spine around, that's something that we'll definitely do first.
Right.
Rule out any possible more complex situations or conditions. And then once we know things are good to go, or you tested everything and everything looks like we're good to start treatment, then we'll begin there.
That's awesome.
Yeah.
Wow. I already feel better about it. Thank you.
No problem.
So in our last few seconds here, please let us know where O'Leary Chiropractic, I got through it.
Yep.
All right, where you guys are located.
Yeah, so we're right on Bay Road, 395 Bay Road, right across from the Harvest Restaurant.
Oh, right. Nice.
Yep, that's usually a good landmarker for people.
Sure.
And we're open Monday through Thursday, 7:30 to 5:30, and then Friday we close at 1.
Okay.
And then I'm also there on Saturdays from 8 a.m. to 11 a.m.
Oh, nice.
Which tends to be one of my busier days because
Sure.
there's not many people open on Saturdays. So
Right.
I always tell people if they can't get in during the week, definitely give us a call because I'll probably be able to fit you in on the weekend.
That's awesome.
And we can get you worked on.
That's great to know.
Yeah.
Thank you for mentioning that little tidbit. Is there anything else you want to mention before we wrap up today?
No, I would say if you have any questions or concerns, I mean, you can always give us a call. We'll jump on the phone. We'll be happy to answer any questions you have. Or if you do have any concerns about coming in, I'd love to be the one to talk to you and change your mind.
That's awesome. Well, Dr. Kevin Collins, thank you so much for being on the show today.
Yes, thank you for having me. It was awesome.
This was great. I learned a lot. I truly did. And there, the world of chiropractic care is bigger than I think the average person knows, right? But I can tell you're passionate about it and you know your stuff. So I appreciate you coming on the show and sharing with us.
Yes, thanks for having me.
Absolutely. All right, and that's all the time we have for today on I'm In with the ARCC. Be sure to tune in next week.